Hey guys, I'm Dr. Girdwood. We're here at Coastal Chiropractic in Port Charlotte. We're here with Jeff today. Jeff has been coming in with some left shoulder pain, and we've been treating him, about 2 weeks now?
I think 3.
3 weeks now. And he's had some subscapular issues is what he came in with, and he's a big golfer. And so he noticed most of his symptoms on the golf course, and he noticed that he was getting some weakness in his subscap, which is what we kind of assess with the exam. But it's been creating some posterior shoulder issues because he's starting to recruit. And so what we've been doing with Jeff is we've been kind of setting his shoulder, which we're going to show you here in a minute, and we've been taping his arm in a way to support the subscap and really take some pressure off of it. And we'll kind of show how we're doing that. So thank you, Jeff, for letting us film this.
Yes, no problem.
So now what we're going to do with his shoulder is we're actually going to set the AC joint at the same time as we're making sure that the humerus is back in the socket where it needs to be. When you have the subscap that gets weak, a lot of times you'll get looseness in the humerus, and you'll actually get some shifting around of that humerus in the rotator cuff. So we're just going to make sure that that is where it needs to be. It actually already just moved there. Perfect. All right, now come on up and swing around this way. How's that feel?
Fabulous.
All right, guys, so now after we've already set Jeff's shoulder, what we're going to do is we're going to use a combination of dynamic tape and rock tape to basically stabilize his shoulder and give him a little bit more support. The difference between these two tapes, dynamic tape is a 4-way stretch, so instead of just stretching long ways like this, it stretches sideways as well. And I'm going to use that for one specific tape on his shoulder. And the rock tape is just a 2-way stretch, so we're going to use that just for more stability taping. Actually, the same taping that I used in a previous video. But his more interesting one is going to be the dynamic tape we're going to use for the subscapularis. Now, the subscapularis is an internal rotator of the shoulder. So when he's golfing, it does basically his backswing. So it brings him backwards because he's right-handed, and it creates that internal rotation. And he tells me when he first came in, that's where he started to notice his pain mostly. So what we're going to do with this is we're going to bring his arm up like this. And because it's an internal rotator, we're basically going to aid that motion. So what we're going to do is we're going to set our anchor down on Jeff's arm, up right inside here. And you're going to want to do your patient a favor and stay off of his armpit hair as much as you possibly can when you do this. Okay, and then what we're going to do is we're actually going to create about a 50% stretch, and we're going to come back and kind of aid that internal rotation of that arm by bringing this all the way up and around over the top of his shoulder here in his back. So if you turn to the right here, turn the chair will just turn all the way around there. You'll actually see how that's coming up and around. Now what that's going to do is when he creates that internal rotation, it's going to help that arm. Okay, it's going to basically take some of the pressure off of it. Okay, so now bring yourself back down, come around this way. Now we're going to have that shoulder come up like this. And this is the same tape job that we did previously. Basically just a stability test or stability tape for the rotator cuff muscles. It's going to take the pressure off the rotator cuff and just give him a little bit of pain relief and give him some more stability in the joint. So again, about a 50% stretch. And again, you want to make sure with these that you bring that right over top of the clavicle and inside of the AC joint. Okay, go ahead and bring that back down. Ooh, and he'll tell you how tight that is and how stable that is. And then the second one, again, we're going to bring him up backwards. Now, when you're doing these different tape jobs, when you have a little bit more tape on the shoulder, what you want to try to do is make sure that your tape is on the skin and not on top of another piece of tape. It's going to stick better on the skin. If it's on another piece of tape, typically you're going to have it lift up. And if at any time, Jeff had to do this before, this tape is very strong. Okay, so there's going to be some movements where you start to create some blistering around the edges of these tapes. If that happens, just peel it off. Okay, if it gets uncomfortable, peel the tape off if you're doing this yourself. And I always recommend consulting a physician before you do any of this. Now this one again, make sure that you come up and over the top of that AC joint, and then take that right on down. Okay, now bring that back down. Boom. So that is his tape job. And so if you look up on the inside, you can see he's got the subscap support. He's got support on the rotator cuff, so these two pieces of tape counteract each other and lift up. If he creates flexion, he has help. If he creates extension, he has help. And if he creates abduction, both of these pieces of tape will go together and make that happen. So he's basically just got support all over his rotator cuff. And now if he gets on the golf course, which he's just about ready to start doing, he just told me he purchased his big summer card. So this is basically gonna help him on the course, take some pressure off those muscles so he doesn't exacerbate that muscle anymore when he's golfing. But Jeff's been doing pretty well, and we appreciate you letting us film this. Anything you want to say?
Thank you, doctor. Good luck, everybody. We have a great doctor right here. It's been very, very helpful to me and to many others. Thank you.
Thanks, Jeff. Appreciate it.
Thank you, doctor.